Welcome to this explainer. Okay, today we're going to do something absolutely incredibly satisfying. We're diving headfirst into decoding a notoriously dense, super specific set of cardiology mnemonics. If you've ever stared at a medical textbook and thought it looked like some ancient, unbreakable cipher, well, you are definitely not alone. But today, we're going to transform those seemingly random letters into literal mental cheat codes. We're talking about the exact memory tricks that take this overwhelming jumble of cardiovascular terminology and turn it into clear, structured, and totally unforgettable logic. I am so excited to share this with you, because I promise, once you see the pattern behind these medical ciphers, you will never look at heart murmurs the same way again.
But hey, first we really have to acknowledge the elephant in the room here. How exactly do you memorize the incredibly complex mechanics of valvular, systolic, and diastolic heart murmurs, let alone the wild fluctuations of jugular venous pressure, or JVP waves? The sheer volume of this terminology, it can feel completely overwhelming. I mean, you've got multiple valves, you've got different phases of the heartbeat, stenosis, you have insufficiency, and they all map to completely different clinical signs. Rote memorization is really only going to get you so far before you mix up a crucial detail under pressure. But here is the good news. What you need isn't just a bigger stack of flashcards. What you need is a system. You need a formula.
All right, let's dive right into this. We are kicking things off with our very first pair of ciphers, pass and paid. Now, at first glance, these just look like two everyday words, right? Maybe a little reminder to pay the toll booth on your morning commute. But in the context of valvular murmurs, these two bizarre-sounding acronyms are actually incredibly elegant structural maps. They take four massive, highly complex variables and condense them down into just four simple letters.
So let's break down the acronym PASS, letter by letter. The absolute genius of this mnemonic is just how direct it is. The first two letters, P and A, that gives you the location, standing for the pulmonic and aortic valves. Then you've got the middle letter, S, which maps perfectly to the specific condition you're diagnosing, in this case, stenosis, right, which is the narrowing of the valve. And that final letter, the last S, that maps directly to the cardiac phase when you will actually hear this murmur, systolic. So string the whole shebang together, pulmonic and aortic stenosis happen during the systolic phase. P, A, S, S, pass. You've just memorized highly complex diagnostic criteria with a single four-letter word.
Now let's take that exact same decoding logic and apply it to our next cipher, paid. Once again, we start with the location. P and A still stand for those pulmonic and aortic valves. But here's the twist. This time, the condition has changed. The letter I stands for insufficiency, when the valve is leaky and just doesn't close properly. And because the condition has changed, the timing of the murmur changes right along with it. So the final letter, D, stands for the diastolic phase, meaning pulmonic and aortic insufficiency occur during the diastolic phase, PAID, paid. By keeping the first half of the mnemonic identical to our previous one, it perfectly isolates the actual variables you need to learn. And honestly, this brilliantly illustrates the sheer power of duality in learning. When you put pass and paid side by side, it clicks. Because the pulmonic and aortic valves share these acoustic properties, this mnemonic pairs them up perfectly as exact opposites. If you've got stenosis, it's systolic. Boom, there's your pass. If you have insufficiency, well, it's diastolic. There's your paid. By structuring the information as a direct contrast like this, your brain doesn't have to work twice as hard to remember two completely separate facts. It just has to remember a single toggle switch. Are we talking about a valve that's too tight or a valve that's too loose?
Okay, so we've mastered the pulmonic and aortic valves, but what about the rest of the heart? Well, this brings us to a slightly more eccentric mnemonic, specifically designed for the tricuspid and mitral valves. Enter our imaginary test subject, the TM patient. Here, TM simply stands for tricuspid and mitral. It's a fantastic little anchor because it effortlessly locks in the locations for both of the upcoming rules we're about to learn. Whenever you see or hear TM patient, you instantly know, okay, we are dealing exclusively with the tricuspid and mitral valves. Now, we're going to look at two distinct clinical scenarios for our TM patient, and I'll warn you, this is where the memory tricks get really creative.
Now, what's really fascinating is when we matrix out these conditions to map them directly to visual waves. We're basically comparing two very different scenarios for our TN patient here. On one side, we've got TN patient IS, VER, and on the flip side, we have the bizarrely modern phrase TN patient SD card. Notice how the first two letters of each phrase define the valve condition and the timing, exactly like pass and paid did, but then they add this entirely new layer. They tell you exactly what kind of wave to look for on a jugular venous pressure chart. So let's isolate the first of these scenarios.
Let's actually chunk this dense information down a bit. We're going to focus strictly on the ISV portion first. The IS part stands for insufficiency during the systolic phase. Simple enough. But what about that little lowercase v tacked onto the end? Well, the absolutely crucial point here is that this V represents a literal V wave in the elevation of the JVP, the jugular venous pressure. This V wave elevation is directly caused by tricuspid insufficiency. Imagine the blood kind of pushing back and creating that specific V-shaped pressure wave. So when you think of a tricuspid and mitral patient with insufficiency during systole, just remember ISV and you instantly know to look for that V wave.
Which brings us to, frankly, the absolute best part of this entire system, the SD card. Yes, you heard that right. To remember something as ancient and wildly complex as a cardiovascular diagnosis, we are literally using the metaphor of a digital storage card from like a 2010 point-and-shoot camera. I mean, it's totally absurd, and that is exactly why it works so incredibly well. Your brain loves to remember things that stand out. When you're trying to recall the intricacies of valve stenosis and jugular waves in a high-stress moment, the phrase SD card is going to pop into your head with crystal clarity. Let's actually move through this and see how it builds into a complete diagnostic picture. So, we start with step 1, TM patient SD card. The S and D give us our baseline right off the bat, stenosis during the diastolic phase. Now for step 2. Think about the word card. What's the most prominent vowel in there? It's the letter A, right? That A in card tells you that you are looking for an A wave in the JVP. And finally, step 3, the context. This A wave in the JVP is caused by an AV block, specifically occurring in tricuspid stenosis. It's this highly specific chain of logic all neatly packed into the phrase SD card. S for stenosis, D for diastolic, and the A in card for the A wave caused by AV block. As we wrap up this explainer, I really want you to think about why all of this matters. In a high-pressure clinical environment, or hey, even just sitting for a grueling board exam, cognitive load is your absolute worst enemy. You simply do not have the time to be sifting through giant textbook paragraphs in your head. You need mental shortcuts that are reliable, structured, and instantly accessible. I mean, if a bizarre tech metaphor like an SD card or a simple pair of words like pass and paid can unlock the intricate secrets of heart murmurs and jugular veins, it really begs the question, doesn't it? What other incredibly dense, impenetrable medical mysteries can be solved with the right mnemonic cheat code? So, the next time you face a mountain of complex data, don't just try to memorize it, decode it.